Hello, welcome to AAMG channel. My name is Esther, the Health Education Manager at AAMG and C6CA. I know that you are here maybe because you heard about the importance of Advance Directive or your doctor referred you here to learn about it. In this video, I will be your host and Evelyn is our health educator. Evelyn, welcome.
Hi Esther, thank you so much for having me here today.
And together, we'll show you all you need to know about Advance Directive. And we will do some hand-holding to help you properly fill out this document. Imagine if your belly hurts or you develop a serious illness and you cannot make your own medical decisions. Who can speak for you? If you have the Advance Directive on file during these situations, the work you do today will be your voice and it will be an important document for your family and your doctor. Let's get started. Ellen, could you explain to our audience what is an Advance Directive?
Oh yes, so an Advance Directive, what it is that they are legal documents that allow patients to formally state their healthcare choices regarding what actions should be taken when they're no longer able to make decisions for themselves due to illness or incapacity. So this includes choosing a medical decision maker and deciding who speaks for the patient, and also making your own healthcare choices and deciding what treatments to have and not to have. So in this way, those who care for you will not have to guess what you want if you're too sick to tell them yourself.
Why do we need an Advance Directive?
We need an Advance Directive because it gives clear authority in making medical decisions. It allows patients to specify if they want to be resuscitated and or if they want to be an organ donor or a tissue donor. And most importantly, it's part of getting the best care possible.
Evelyn, what are the benefits of an Advance Directive?
Benefits of an Advance Directive. Even though only about 37% of Americans have completed Advance Directive, the presence of an Advance Directive decreases the rate of hospitalization and increases the likelihood that a patient will die in the preferred place. Also, the presence of an Advance Directive increases the rate of hospice or palliative care and the quality of life for patients and their family. Some advantages include that you are the one who's in charge of making your own medical decisions and that these documents can be changed at any time. You do not need an attorney to fill out these forms, and most importantly, it allows you to express your own wishes and no one else's.
Any disadvantage of the Advance Directive?
Disadvantages for an Advance Directive form is that the form may not be available when needed, such that it may not be readily accessible in your patient's chart in a time when your healthcare team needs to review it. For the living will portion of the form, also known as the healthcare choices, it may not be specific enough. Another thing is that it may not be immediately translated into a physician's order. However, even though there are disadvantages, together we help you minimize these disadvantages as we move along in the presentation.
Advance Directives are for the older people. Is that true?
This is false. It's a myth. The fact is that anyone aged 18 or older, they're qualified to have an Advance Directive on file.
Is it true that an Advance Directive is an order to withhold CPR?
This is also a myth. CPR can be a life-supporting treatment option if chosen within the healthcare options.
Are Advance Directives decisions to allow someone to die?
This is also a myth. The fact is that Advance Directives are legal documents that aid in making medical decisions and treatment options.
An Advance Directive means don't treat?
This is false. It's a myth. The Advance Directive form doesn't mean don't treat. However, the form does allow you to explicitly state what treatment options you want when you're not able to speak for yourself as part of the making your own healthcare choices portion of the form.
What other Advance Directive consists of?
Parts of the Advance Directive, it can vary depending on state laws and individual preferences. There are 3 parts: the durable power of attorney for healthcare, or in California it's also known as the medical decision maker. There's the living will, but in California it's known as the healthcare choices. And the third part is signing the form and having 2 witnesses sign it with you or having the form notarized.
So could you actually tell us what is the difference between the living will and due power of attorney?
Yes, so for an advanced directive, there is the durable power of attorney and also the living will. The durable power of attorney is also known as your healthcare agent or an authorized medical decision maker. So this medical decision maker can be your spouse, your life partner, a relative, a parent, your adult child, a sibling, or a friend. Most importantly, it is essential for this person to know you well, as someone whom you trust to speak for you when you need them to. As for the living will, this covers healthcare choices in a terminal situation. For example, do you want CPR, mechanical ventilation, kidney dialysis, medically administered nutrition and hydration? I'll be going more into detail what these are later in the presentation.
So if you are a medical decision maker, what are their responsibilities?
So your medical decision maker is able to agree to, say no to, change, stop, or choose your doctors, nurses, or social workers, what hospitals or clinics you're treated at, where you live, the medications, tests, or treatments that you undergo, including your life support treatments. They're able to review or release your medical records and also arrange for end-of-life care.